Dear board, dear ladies and gentlemen, I'm happy to have the talk about the SI joint registry. What is ISAR at the 4th International Conference on SI Joint Surgery 2021? My disclosure of interest, I'm a former tutor for Cygnus. So ISAR, what is ISAR? It's an international sacroiliac arthrodesis registry. So we have some problems. All of our SI joint surgeons usually have only a small numbers of surgeries they do over a year. And so for us, it's difficult to make studies because of a small number of patients. Sometimes it's difficult to have follow-ups with the patients because of the distance to the patient and because insurance companies do not cover the follow-ups. And one very important point is that we have a problem in measuring good results. So how do we measure our results after SI joint surgery? It's different to maybe total knee prosthesis where we can measure stability and function, or ACL repair where we can measure stability and range of motion, or in shoulders where we have range of motion. We cannot do these things at the sacroiliac joint. So what is a good result? The history behind the ISAR is a very good talk by Professor Sobotke at the ICSJS at Hamburg 2016, where it told us a lot of things about registries and advantages, disadvantages, and compared it with RCTs and so on. So we as a group thought, why don't we get a registry? It's so important, and this is something that will bring us ahead. But what questionnaires do we have, and what questionnaires can we use in a registry? We have the ODI, we have the Eurocall. Meanwhile, we have the Denver SI Joint Questionnaire by Vic Patel, and we have the Pelvic Girdle Pain Questionnaire by Bridge Stooge, which is mainly for younger women after delivery. So ISAR, we will deal with our daily problems which we have at SI joint treatment and surgery. So what ways of diagnostics do we have? How do we identify the SI joint pain patients and try to not to miss anyone or overdiagnose and over-treat the patients? What are the key questions we have to ask to the patients to find them? And what are the most important clinical tests we have to do to diagnose these patients? What different radiologic tests and surveys can we do to get the diagnosis or to rule out the diagnosis? And what is the role of infiltrations in finding these patients? Which ways of treatments do we have? When do we start conservative treatment, and what types of conservative treatment are the best? When do we switch over to surgical treatment, and what are the different advantages and disadvantages of the different types of SI surgery, especially if you look at the growing market of implants? And how can we control our results? Is it only history, or do we have clinical tests? Do we use radiologic surveys? Which questionnaires do we use? These are still in development, so it's a beta version. The latest upgrade should show up during the next weeks with a lot of improvements. The most important aim is to get a tool to follow our patients, measure our results, and to improve our questionnaires. I got in contact with these guys, Professor Rumpold, Professor Holzner, and Jens Lehmann. They work in the ESD or JAS at Innsbruck, and they make a lot of studies and registries, and so they helped me a whole lot with developing an ISAR and make a really good job. So how do we start with the registry? It's this URL, isar-main.js.pro. This is the starting page to log on. And then you will get to the main page, which is the patient list. At the very beginning, of course, it's empty. And if you have more patient, it will maybe look like this. So this is the study center. This is the patient ID, which is given by you. Maybe it's the ID of your institution, date of birth, date of admission, the affected site. And here you can see the questionnaires. So this patient has already had 2 questionnaires. Some of the questions are missing, but not too many. And these questionnaires will show up during the next period of time. What will the surgeon be asked? So the surgeon has to fill in some data about baseline data and longitudinal data. And especially in longitudinal data is important because here you assign the patient to your chosen way of treatment at the moment. So it's conservative treatment, infiltration, denervation, or fusion. And to some degree, you can edit all these type of therapies. So at infiltration, you can choose what type of infiltration you use or what medication you use. At denervation, you can choose whether it's done percutaneously or endoscopically, and so on. And here's another point, it's ISAR rating. And here you're able to fill in the clinical tests you did, the radiologic tests you did, or the SI joint infiltration that you have done. You can give this information always if you have the patient on a new type of therapy. Here's a list of some of the clinical tests you can do and the results you get, or the radiologic survey you do, like lumbar spine, pelvis, or hips. And here are some information about the SI infiltration that you've done, the technique, the way you guide your injection, and so on. So what will the patient be asked? We use 4 different questionnaires. Eurocall 5D, 5L, the ODI, and the SOS will be asked at every follow-up in the registry. And every time you start the patient on a new type of therapy, the SI history questionnaire will be asked again. So this is only at T0 baseline if you start on the therapy, and all the others are at T0 and at every follow-up. SI history questionnaire contains 25 questions, general questions, and you ask for osteoporosis, smoking habits, previous surgery of SI joint, spine or hip, SI pain history, working situation, previous psychiatric treatments, etc. Eurocall 5D, 5L is well known, consists of 6 questions and measures health in general. ODI, also well known, 10 questions. Basically, it's a pain questionnaire about lower back pain. So it's not specific for a side joint pain. And for future, maybe we have to switch over to the Denver SI joint questionnaire developed by Vic Patel, because this is more specific for SI joint. And then there's a new one, SOS, the Sacroiliac outcome score. So far it's not tested, it's not validated, consists of about 30 questions and asks for the impairment of function, pain, fear in job, sports, privacy, and social life, the use of analgesics and narcotics, and if so, maybe for revision of SI implant. So it still needs to be tested, adapted, validated, and maybe condensed down to less questions. This is an example of one way it could go. So you see the patient in a consultation decide that he should be on the registry. The patient agrees, and so you start the patient in ISAR with conservative treatment. You assign the patient to this type of therapy, and 4 questions will be asked. 3 questionnaires will be asked at different follow-ups. But patient doesn't improve. You see the patient in the follow-up, decide to have him on another type of therapy, maybe infiltrations. you start with 4 questionnaires, 3 questionnaires, three questionnaires. Patient still doesn't improve under infiltration. You decide in this follow-up that he will have some fusion or stabilization. You do the surgery. The patient will have 4 questionnaires before surgery. And of course, every one of these yellow points of time, you will have the ISAR rating. And then another follow-up with 3 questionnaires. Here the patient still doesn't improve. You decide to have revision surgery because of loosening, and so on and so on. This is what you see in the registry. You look at the point therapy types and studies. You see the denervation of the left side. This is baseline. This is when the procedure is done. Patient can ask before the procedure is done. Will answer the questionnaires, 4 different. And first follow-up in the registry, 2-week window. Patient will answer these 3 questionnaires. What do we get from this registry? Some simple and quick answers. So in that example, the patient had a denervation of the right side, and here we can see the SOS from baseline to the last follow-up. And of course, we can get much more complex answers and data. So you have a special page where you can choose what questionnaires you want to extract and what filters you want to use and which format you want to go. And then you can start the export and get the data. How to become a user? So far it works only for SIMEG members. So far we only offer German and English versions, and you have to send an email to SIMEG. We need your name that you want to show up in the registry, your username. We need to have your first and last name and your title, the department you work in, the hospital or office you work, and your address, your email, and your phone number. And once you're registered, you will get the credentials to log on, like I showed it before. You will only see the results of your own patients. The patient will see his or her own results, and the registry, we will see all the results. Next step with ISAR. Hopefully we see the next update the next weeks. Then we have to find interested surgeons that will work with the registry and help with finding bugs and improve the system. If this works well, we will switch over to more languages, of course. Then we have to discuss whether we need the SOS questionnaire or are we happy with Denver one and the Eurocall or whatever. We have to get started with the registry to get more and more patients into the registry and someone see the long time follow-ups. And if you're interested in working with the ISAR, please contact the registry. You will find us on the SIMEG International homepage under special interest groups, projects, case registry, and then you can click here and join ISAR by giving your data. Thank you very much for your attention, and I'm happy to answer your questions at the Congress.